Hi there, we're going to start off talking about abbreviations and systems of measurements. So upon completing this, you should be able to identify common abbreviations and symbols used for medication orders, describe the responsibility of a healthcare professional regarding verbal and telephone orders, interpret medications orders correctly, convert dosages between and within systems of measurement, and describe appropriate patient education for those who will be measuring and administering their own medications. So medical abbreviations, interpreting medication orders is a form of written communication that is critically important to healthcare providers. So knowledge of abbreviations and symbols used in medical communication is critical in ensuring accurate interpretation of physician orders. Some of the most common ones include, and they're on this chart, the abbreviation A, meaning before, abbreviation ml for milliliters, GTT for drops, AC is before meals, MM for millimeter, SUP for suppository, AD for right ear, NPO for nothing by mouth, QID for 4 times a day, AS for left ear, OD for right eye, QH for every hour, BID for twice a day, OS for left eye, SC for subcutaneous, CAP for capsule, IM for intramuscular, SL for sublingual, DC for discontinue, IV for intravenous, SR for sustained release, MEQ for milliequivalent, HS for bedtime, TID for 3 times a day, milligrams, or sorry, MG for milligram, PO for by mouth, TSP for teaspoon. You need to be aware of the official do not use abbreviation list. I did include a link to a PDF on our Moodle page that lists the JCAHO do not use abbreviation list. These abbreviations have been recognized by the Joint Commission as problematic due to misinterpretation, really should not be utilized when communicating verbal telephone prescriptions, labels for drugstore bins, medication administration records, pharmacy and prescriber computer order entry programs. So familiarize yourself with the do not abbreviation list just so you are aware when you are writing an order that you're not using an abbreviation that's not approved. There are some abbreviation examples on here for the do not use list. Someone may write BT for bedtime, which can be mistaken as BID, and just some of the others that are on here. QID, Q1D for Q1 day can be mistaken as QID. QHS for at bedtime can be mistaken as QHR for every hour, so you're supposed to write out nightly. HS for half strength can be mistaken for bedtime, so actually write out half strength. There are 6 parts that are required when receiving a medication order. You need to have the date and time the order was taken, the patient's name, the medication name, the dosage or amount of medication, the route or manner of administration, directions for use, including time to be administered and/or frequency. There may be times a physician will call in a verbal order, and when this occurs, it's the responsibility of the healthcare professional receiving the order to obtain the name of the person calling the order in, writing the order down, and read the order back to the physician for verification. To avoid delay in patient care, the physician will sign the order upon receipt at a later time. Medical assistants or nurses who are calling in a telephone order should be sure to repeat all the drug information back to the physician to ensure that they have the proper orders. In addition, after the order has been called in, proper documentation such as the time, date, and name of the individual taking the order at the facility or pharmacy should be properly documented. This is extremely important to avoid medication errors and legal complications. Different forms of digital medication order submissions. So we have a computerized physician order entry system. This is the implementation of computerized medical records. It allows medication orders to be sent digitally. Inpatient settings utilize e-prescribing or ERX, which allows prescriptions to be ordered through the patient's electronic health record and sent directly to the pharmacy. Then there's electronic medication administration record, or an EMAR, and this is how administered medications are recorded in the patient's health record. Ultimately, it's the physician's responsibility to ensure that all medication orders are complete and have all the required components to address any missing information or discrepancies. To reduce medication errors due to misinterpretation, cautionary measures such as legibility, printing, and/or writing the name of the medication and prescribing the quantity of the medication in both textual and numerical formats should be taken. The prescriber's name must be written or typed below the signature. There's an image here that is a prescription blank. Check for completeness, legibility, and accuracy, including date, name, medication name, dosage, route, frequency, and number of refills, and the physician's drug enforcement administration or DEA number for controlled substances. Prescriptions may be printed, phoned, faxed, or electronically sent to the pharmacy. Systems of measurement when we talk about medication administration. There's the apothecary system. The apothecary system has mostly become obsolete. An apothecary is also known as a pharmacist or a druggist. This was the original measurement system that utilized weight for writing medication orders. The metric system is the most preferred system of measurement which is currently used. It's based on the powers of 10. Milli represents 1,000th, multiplying by 0.001, simply moving the decimal point 3 places to the right to convert to grams. This is based on 3 basic units of measurement: liters, meters, and grams. Then there's the household system, and this is the least accurate. When having to convert from metric to household, consult a conversion table or a pharmacist to avoid dangerous errors. It may still be used in a home setting and has access to the few basic equivalents commonly used. So common medical conversions. The following simple system can be used to convert between grams and liters: milligrams, milliliters, and micrograms, microliters, which are conversions needed for drug dosage. In the chart below, each box represents a power of 10, and you simply move the decimal from the number of places in the direction started with the unit you're given. For example, 500,000 micrograms is equivalent to 500 milligrams by moving the decimal point to the left 3 places. An example of a common medical dose conversion. If a patient weighs 170 pounds and is ordered a drug dosage at 10 milligrams per kilogram, you need to calculate how much drug they should receive. You need to change the pounds to kilograms. Anytime you see an order that has a medical conversion and the order is in pounds, always change that to kilograms first. Once you have your kilograms, you can write the given weight over the denominator of 1. This would be for dimensional analysis. Then place the unit you want to cancel, which is pounds, in the denominator for the unit you want to convert, which is kilograms, in the numerator of the second fraction. Because the dose reads 10 milligrams per kilogram, this patient should receive 10 times what their weight in kilograms is, which is 72.27, or 727.7 milligrams of the prescribed medication. You may need to round depending on the medication units that are available. Patient education for self-administration. So there's a critical patient education that should be provided to the patient to ensure safe administration. They include clearly written instructions for the patient, provide instructions to the family member that may be assisting, clearly marked measuring spoons and cups for household measurements, advise the patient not to use tableware such as teaspoons or tablespoons or teacups or drinking glasses due to the inaccurate measurements. Always speak directly to your patient to ensure comprehension and make them repeat the instructions back to you. Thank you for listening.